Hi, this is Dr. Roy Kim, and I will be talking about my fun-filled time at the AAFPRS meeting in 2024 in New Orleans, Louisiana. So in case you don't know, facial plastics is technically not plastics. So specifically, my training is in general surgery and then going on to plastic surgery. There is an alternate track. So you can do ENT, otolaryngology, and then do an additional year of fellowship training in facial plastics. So they tend to stick to things basically at the neck up. They tend not to do any breast or body work. So that is a big difference. And of course, there's a lot of competition, but essentially, hey, if you're well trained, you can definitely operate on the face. And I was honored to be invited to this meeting. So I did give two talks, one on AI and aesthetics, and the other one on how to melt calcium hydroxyapatite, also known by the brand name Radius. So both of the talks went great, and I got a good response from both. So I did learn a lot of new trends or ongoing trends, and this is what I took away. First of all, with facelift, deep plane facelift in my world, plastic surgery, American Board of Plastic Surgery, is still not a huge thing. There are definitely more and more people doing it, but I would still say that the minority of plastic surgeons do it this way. Total opposite in facial plastic surgery. So more specifically, I would guesstimate 89% of facial plastic surgeons are doing a deep plane approach, and they definitely get great results. So I am now much more sort of open to deep plane. So more specifically, I am doing it. I've been doing it for years, but I do think that the ability to help more patients or to get an extra, let's say centimeters or more of lift, but have it longer lasting with a little less downtime, hey, I'm all for it. And I think deep plane is here to stay, and I'd be happy to talk about it further. I did see a fantastic lecture on a plastic surgeon who actually does a deep plane technique under local anesthesia, which I have never seen before. So he does inject a lot of local numbing medicine, and the patients do get some oral sedation medication, and it's still done in an operating room setting. However, yes, he's able to get a deep plane under local or local with light sedation. Very impressive. He gave away hints on how to do that. And not certain if I'm going to do that yet. I think I need to visit him to get even more hints that you can't really get in the lecture, but it is an intriguing thought. The other thing is that I learned about the micro lift. So this is a technique done by a facial plastic surgeon in New York, where you make a small incision sort of around here in the forehead area, and what you want is a vector, a line, really that starts at around here. And if you want this lifted up a tiny amount, that can be done in an office setting. This is great for younger patients, and interestingly, this is also great for patients who've had a facelift in the past, do not want to have the big overall facelift redone again, but simply want a little more vertical lift in this area. It works great in the right patient. If you have a lot of loose skin, it doesn't work that well. However, if you have a smaller amount of loose skin, or little to no loose skin, but you sort of have soft tissue sag right here, it is very, very interesting. It's a very intriguing technology as well as approach. Now, with the nose, there is a huge approach towards preservation rhinoplasty, towards having more limited incisions. And this is a minority view amongst plastic surgeons in my field. Interestingly, it's also a minority view or technique in the world of facial plastic surgery. It is definitely not the majority of facial plastic surgeons that are doing this. I do think that it does require some skill to do, or more cases, or more understanding of the anatomy. So I think that this will maybe not take off as quickly as the deep plane facelift. However, I do see more and more people doing it. Now, of course, there was a section on minimally invasive techniques as well as technologies. I think the biggest things I took away from that is, hey, they're doing a great job. The biological therapies are really slow to come to the US thanks to the FDA. I did see an intriguing new product that we spin your blood instead of getting PRP. You put it in slightly different test tubes and we get PDGF, which is platelet-derived growth factor. Since it's your own PDGF from your own blood, yes, it's FDA approved, it's a great product, and it can really help in wound healing a little differently than PRP. So I do think that has a great application. The other cool thing I found in minimally invasive is that there's a brand new company that has better AI-driven selfies, so that the recommendations that the AI generates, right now it's minimally invasive like Botox, neuromodulators, fillers, skincare, lasers, things like that. But it's not that the software works so well that, hey, the after is this fake after and you have a dramatic result. Rather, it's extremely realistic. So when you take your selfie, the AI software will tell you, okay, this is what you need. You need these 2 things, 4 things, whatever, and this is what you look like afterwards. It's very accurate. And honestly, it's pretty fast as well. The AI model takes about a minute, maybe 45 seconds to give you a result. So that's very impressive. The other cool thing is that it only needs a smartphone camera, so it works on iOS or Android devices. So, of course, New Orleans is always fun. In case you don't know, it has a history of being run by the Spaniards, or the Spanish, and run by the French. It has Cajun food. And the specific weekend I went to, it was Halloween weekend, right before Halloween, as well as 3 Taylor Swift concerts. So there was a lot of action out in the streets. So it was a lot of fun and a blast. Thank you especially for the invitation from AAFPRS for being allowed to talk there and being invited to speak. It was a lot of fun. I really learned a lot and I enjoyed myself and made a lot of new friends. So if you have any questions for me about the meeting, about any of the technologies or techniques that I talked about, please let me know. Have a great day.